Welcome. Today, we're diving deep into a critical cardiovascular condition, cardiogenic shock. It's a severe illness where your heart suddenly can't pump enough blood to meet your body's needs. Understanding this condition is crucial for recognizing its signs, getting prompt treatment, and ultimately improving outcomes. So, what causes this life-threatening condition? The leading cause is a severe heart attack, also known as myocardial infarction, where a significant portion of the heart muscle is damaged. This damage weakens the heart's ability to contract effectively. Other causes include conditions like advanced heart failure, arrhythmias, which are irregular heart rhythms, myocarditis, and inflammation of the heart muscle often caused by viral infections, and structural heart problems, such as valve disorders or congenital heart defects. These conditions can all compromise the heart's pumping function, leading to cardiogenic shock. To understand cardiogenic shock, we need to explore the pathophysiology. When the heart can't pump efficiently, cardiac output drops dramatically. This reduced cardiac output leads to decreased blood pressure, impairing the delivery of oxygen and essential nutrients to vital organs. The body attempts to compensate by activating the sympathetic nervous system, resulting in increased heart rate and vasoconstriction. However, this compensation is often insufficient and can even worsen the situation by increasing the heart's workload. Ultimately, the lack of adequate oxygen delivery causes cellular dysfunction, organ damage, and if left untreated, death. Cardiogenic shock is a serious condition, but it's not the most common type of shock. Its incidence is estimated to be around 5 to 10% of patients who experience a heart attack. The mortality rate is unfortunately quite high, emphasizing the need for early diagnosis and aggressive treatment. Risk factors include advanced age, a history of heart disease, diabetes, and prior heart attacks. Recognizing these factors can help healthcare professionals identify patients who are at higher risk and implement preventive strategies. Recognizing the signs and symptoms of cardiogenic shock is crucial. Key indicators include rapid heartbeat, severe shortness of breath, cold, clammy pulse, skin, a weak confusion or loss of consciousness, and significantly decreased or absent urination. The patient may also experience chest pain or discomfort. Remember, these symptoms can develop rapidly and require immediate medical attention. Diagnosing cardiogenic shock involves a comprehensive assessment. The medical team will evaluate the patient's vital signs, perform a physical examination, and review their medical history. Diagnostic tests include an electrocardiogram, EECG, to assess the heart's electrical activity, blood tests to measure cardiac enzymes and other markers of organ damage, an echocardiogram to visualize the heart's structure and function, and a pulmonary artery catheterization to measure pressures in the heart and lungs, providing crucial information about the heart's pumping ability and the patient's overall hemodynamic status. While cardiogenic shock is often considered a single entity, it can be categorized based on its underlying cause and severity. The Society for Cardiovascular Angiography and Interventions, or SCI, has proposed a classification system that ranges from stage A to E. A represents at-risk patients, whereas E represents extremis, which is the most severe form of cardiogenic shock. These classifications help in determining appropriate treatment strategies and predicting patient outcomes. The primary goal of treatment is to restore adequate blood flow and stabilize the patient. Initial measures include providing oxygen, administering intravenous fluids carefully to avoid fluid overload, and using medications to support blood pressure. Inotropic agents, such as dopamine or dobutamine, can help strengthen the heart's contractions, while vasopressors, like norepinephrine, can help constrict blood vessels and raise blood pressure. In some cases, mechanical support devices, such as an intra-aortic balloon pump IABP or a ventricular assist device VAD, may be necessary to assist the heart in pumping blood. Coronary angiography and percutaneous coronary intervention (PCI), such as angioplasty and stenting, are often performed to open blocked arteries in patients with cardiogenic shock due to a heart attack. While not always preventable, several strategies can reduce the risk of developing cardiogenic shock. Managing risk factors for heart disease, such as high blood pressure, high cholesterol, and diabetes, is essential. Adopting a healthy lifestyle that includes regular exercise, a balanced diet, and avoiding smoking can also significantly lower the risk. Early recognition and prompt treatment of heart attacks are crucial in preventing the progression to cardiogenic shock. The prognosis for cardiogenic shock depends on several factors, including the underlying cause, the severity of the condition, and the patient's overall health. Despite advances in treatment, the mortality rate remains significant. Recent research has focused on improving early identification of at-risk patients, developing more effective mechanical support devices, and exploring novel therapies to protect the heart from further damage. Ongoing research and clinical trials hold promise for improving outcomes and enhancing the quality of life for patients with cardiogenic shock.